Help, this coil has fallen and he can't get up.
Medical examiners will be looking at his right and left sides to figure out what is wrong and what he broke and tore.
Due to the amount of injuries the patient has sustained, we must evaluate his axial and appendicular skeleton. His axial skeleton is his head, neck, and trunk, which is essentially his torso and his hip area. And his appendicular skeleton are all his limbs, so his arms and his legs.
Superior means to be closer to the head region. Therefore, his cut on his head is superior to the cut on his knee, and inferior is away from the head region. Therefore, his broken foot is inferior to his broken neck.
Posterior is the back of the body, so Mr. Fuzzyears' tailbone is posterior to his cracked rib, and anterior is toward the front of the body, so his cracked rib is anterior to his busted pancreas.
Mr. Fuzzyears' broken nose is medial to the scrape on his ear, and his bruised cheek is lateral to his busted chin.
Yeah.
Medial is toward the midline of the body, so close to this area, and lateral is away from the midline, so out in this area. Mr. Fuzzyears' bruised elbow is proximal to his broken finger, and his torn ankle is distal to his hurt knee. Proximal is closer to the trunk of the body, so up in this region for the arms and this region for the legs. Distal is farther away from the body, so here on the fingers and here on the feet. Mr. Fuzzyears' scratch on his chest is superficial to his broken rib, and his busted pancreas is deep compared to his broken spine. Superficial is closer to the body's surface, or closer to the skin, while deep is closer to the inward part of the body, where most of the internal organs are.
So Mr. Fuzzyears is unconscious, which means something is wrong with his dorsal body cavity. The dorsal body cavity contains of the cranial cavity and the vertebral cavity. The cranial cavity is the brain, which is the skull, which encases the brain, and the vertebral cavity is the spine, which encases and protects the spinal cord. Mr. Fuzzyears has a lot of damage in his internal organs in his ventral body cavity. His ventral body cavity includes his thoracic cavity and abdominopelvic cavity. The thoracic cavity includes everything above the diaphragm, which would be his heart and lungs, and the abdominopelvic cavity would include everything below his diaphragm, which would be his stomach and pancreas, to name a few.
In order to better examine Mr. Fuzzyears' injuries, we can split his body into right and left parts. If we were to take a piece of string and say, go like this, we would now have a sagittal plane of Mr. Fuzzyears' right side of his body and his left. If we were to go right down the midline, that would be a mid-sagittal plane. Dividing Mr. Fuzzyears' body into frontal planes, we would take a line, and now his body is divided into two separate chunks. If we were to cut Mr. Fuzzyears' body transversely, then we would split his body into an inferior and superior part. When medical professionals are quickly trying to describe which section of the body has an injury, they use the right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrants of the body. These different sections are simply the patient's right or left, and whether they are up towards the head or down towards the feet. In regards to the abdominopelvic area, it can be split up into 9 specific sections. The right side and 3 sort of divisions. The right side, the left side, and the central area. The right side consists of the right hypochondriac, the right lumbar, and the right iliac sections. The right hypochondriac essentially means under the cartilage of the rib bone. of the ribs. The right lumbar is the section where it's sort of on the lower back and above the hip bone. And the iliac is on the right side. Right iliac is on the right side and above on the hip bones, or in that general area. For the central section of the body, there's the epigastric region, which means on the stomach, the umbilical region, which is on the belly button or where the umbilical cord is, and then the hypogastric region, which is below the stomach. The last section is the left side, which is essentially the same as the right side, just on the left. The left hypochondriac is again the part below the ribs. The left lumbar is the lower back and above the hip bone, and the left iliac is on the hip bone. After extensive surgery and intensive care, Mr. Fuzzyears is in a full body cast and expected to make a full recovery. Hey. Oh no! Oh dear. Help, this koala fell and he can't get up. He needs serious medical. Jesus Christ.
Medical examiners will be looking at his.
We good?
Superior is closer towards the head region. So for instance, the cut on his head is superior to the cut on his knee, and inferior is away from the head region, so down in this area where his foot and
Posterior is the back of the body. So his